So, have you ever wanted to change the course of history? Your legacy for your children or your grandchildren. That's what this could be. So, a legacy, Google and Amazon have a legacy as disruptors of the marketplace. Bill Gates has a legacy contributing to the demise of polio. But all three of these have the same problem, and it's called the last mile. How do you deliver goods and services the last mile? How do you deliver the polio vaccine the last mile? And how do you re-educate people about a disease that they thought was long eradicated? So my family and I went for 3 weeks with this fantastic organization called Youth with a Mission because my eldest son was on his gap year in 2015, and we went to visit him and volunteer. So Youth with a Mission ships is like Mercy Ships of Africa. They partner with the World Health Organization and local governments and businesses and people like you to bring healthcare to far-reaching places in Papua New Guinea, Indonesia, the Philippines, and other small islands in the South Pacific. Some of these people have never seen a dentist before in their life, and this is my 17-year-old daughter. Some have never been immunized against anything to prevent preventable childhood diseases. And some have never known that if you just simply wash your hands, you're going to eliminate a lot of diseases. And this is one of my 15-year-old twins. So they put you to work on this ship. It's amazing. You don't think you could do anything? They'll find something for you to do. It is just amazing. But this last mile is what the ship does. Is it delivers education, medication, manpower, and medical supplies. That last mile. Some of the canoes, they still have to paddle for 2 weeks to even get there. So have you ever been at a medical conference like the AAD and you knew 2 physicians that would benefit from collaboration, or a resident who wanted to learn a new procedure and would benefit from meeting an expert in his field? Well, I was recently speaking at a Rotarian conference, and I said, well, people who could be resources and connect me with other, a collaborator and enabler to come afterwards and talk with me. And someone like you came up afterwards and introduced me to a resource here in my hometown of Atlanta that I didn't even know existed. And I'm going to talk to you more about that in a minute. Another thing is, have you ever been in a situation where no one really believed you? I mean, like Columbus saying the world was round, they were, questioning this, thought he was crazy. Well, this happened to me the first time I was on the medical mission ships, because I was the first dermatologist on board. So I was seeing things the way you and I would see them, through the eyes of a dermatologist. I was evaluating new diseases and seeing them and evaluating like a dermatologist would. So this was my first patient, and she had paddled for 2 weeks in her canoe to get to see me, because I was a skin doctor on board, and she had been treated for 15 years for a sunburn. So I need your help. What's a differential diagnosis? Come on, just shout it out. What do you think when you see this? We're all dermatologists, What do you think? We can do this. Lupus, sarcoid, weird BCC. So I told her we needed to do a biopsy to confirm the diagnosis, and she physically dug into her nose and tried to hand me a piece with no anesthetic, no nothing. So now does anyone have a differential diagnosis? So it turns out that her grandfather had had leprosy, and leprosy had been eradicated from Papua New Guinea since 1990. So they couldn't even find the form to refer her for treatment on the ship, and no one believed me. These are some of the other patients that I saw. I talked to you about how you could introduce people, friends, and they could collaborate. So it turns out the Leprosy Mission International was down in Papua New Guinea, but they had never been to some of the places that Youth with a Mission ships was able to serve. So I was able to foster a new partnership between them. And the most fascinating, wonderful thing is that the World Health Organization will give medication until leprosy is eradicated and cured for free. So all the pieces are there. See, here's the medication. So all the pieces are there. We just need to connect the puzzle. It's a very simple little puzzle to put together. Now, we're no longer isolated here in the U.S. There's 150 new cases of leprosy diagnosed yearly. In fact, in my hometown of Atlanta, there's 3 new cases a year and about 20 cases that Emory's CDC leprosy clinic is following a year. So we're no longer isolated. It's hard to believe that we're supposed to be at global eradication levels of less than 1 to 10,000. And developing countries, it's supposed to be eliminated. So we're not reinventing a wheel. I mean, basically, I'm trying to connect existing, well-established organizations and connecting resources and education with public health care workers that are right there. We're basically trying to provide that last mile. So if you want a secret to developing your legacy and you like to take exotic vacations, I'm telling you, this is amazing. So if you, in a room this size, there are people that could be financial resources, educators, collaborators, or volunteers. If you're one of those resource people, can you please come see me afterwards, because I'm trying to connect a bigger source. And if you want to volunteer, my email is on here and also a link to volunteer at YWAM Medical Ships. But it was an amazing experience. They connected, my husband is doing an EMR for the ship. My son, oldest son, thinks he wants to be an ophthalmologist now. They made my daughter, serve in the dentistry area, and my twins were doing healthcare. They'll find someplace. The captain of the ship, their sons were, I think, 4 and 6. It's amazing the things you can do. Thank you so much for the opportunity.